It can be a very difficult decision for anyone when faced with the fact that an older family member may need to be moved into an assisted living facility, but it doesn't always need to be the only option.
That's right. Your loved ones can stay independent and at home thanks to Home Instead Senior Care. And Tina Delgado and Bonnie Keller are here to tell us how it works. It's a pleasure to have you here.
Thank you.
Thank you so much.
So good to see you. So let's talk about reducing unnecessary hospital visits. This type of care is something that can really help people just stay at home and recover there, right?
Right. So really what's important, I think, and brings value is that there's confidence and there's knowledge and there's engagement and achievement. And really all those play a focus. Family caregivers who supplement Home Instead Senior Care in with their care plan, they're starting to share with us that there's so much more life balance, really life-work balance, a little bit healthier and much better for them.
And a lot of relief too.
Yes.
I would imagine.
Absolutely.
And what was really surprising to me was to learn that the Medicare costs of hospital readmissions is over $17 billion annually.
Wow.
I had no idea the problem was that big.
Yeah.
So besides the financial impact on the patient and our entire healthcare system actually, it really increases people's quality of life to remain out of the hospital, avoid these readmissions, and it reduces the stress on the patient.
Yeah, because it's not just stress on your body, but mentally it can really take a toll, I can imagine. Absolutely. So what are the other benefits of this program?
Some of the other benefits are just promoting medication self-management, actually a really healthy nutrition plan, something that's appropriate to them with all their situations. Some diets may not be healthy, and then just maintaining their follow-ups and any scheduled appointments that they have, maybe reintroducing them to their social environment and just keeping them safe, looking for any red flags or warnings.
Right, there's a subtlety to the care, right? I mean, it's somebody that's sort of just helping you maintain that life that you're used to.
Yes.
Is that how you'd put it?
Absolutely. And you know, the other thing that really impresses me, and a lot of people don't know this, but there's a whole entire team of professionals that are all working together and are all actively involved in the care and the well-being of every single client, in addition to the actual caregiver. So that's something I have just never, ever seen before.
So what are some of the conditions with the highest occurrence of readmissions, would you say?
So those conditions include cardiovascular diseases, congestive heart failure, pneumonia, infections, diabetes, arthritis, multiple chronic conditions, and the three main reasons for hospital readmissions. Those include complications or infections related to the first hospitalization, poorly managed transitions during discharge, and the reoccurrence of chronic health conditions. So the services of Home Instead can greatly impact those reasons in a positive manner.
Yeah, starting off right with the transition, it sounds like what you say is so important.
Yeah. And Tina, you were talking about some of the benefits of the program, which I'm sure play into some of the main areas of focus to reduce readmissions, right? So what are we talking about in terms of areas of focus?
So really, I really think that the patient is the focus. And in collaboration with Home Instead, the physicians, the hospitals, the skilled nursings, the therapies, and the families really leave hardly any gap for a readmission. Home Instead focuses definitely on the medication management, and the follow-up appointments are going to be key. Their nutrition has to be solid for their rehab, and really just we're looking for red flags at the time of discharge.
Including home environment. We were just seeing a picture of someone rolling up a rug. I mean, that can certainly become sort of an obstacle, right? That someone could trip over.
Falls are one of the biggest reasons in older people when they get sick.
That's right. This is just an example of the extra step a caretaker would take, right?
Absolutely.
Caregiver, I should say.
The caregiver. And we have a quality assurance process also. Bonnie pretty much heads that up.
Absolutely. We focus on quality assurance visits with the clients and reviewing the caregiver notes to look for, changes, subtle changes, and early warning signs so we can react proactively. And also a big key is to look for other resources that can benefit that client and help to get those things in place.
So a lot of people are watching at home looking for somebody who's trustworthy, wanting to get this help with their entire family. So talk about the satisfaction that you've gotten from some of the patients that you've had, maybe some of the successes.
It's really kind of an interesting statistic, but nationally, 15 to 25% of all seniors are readmitted to the hospital within 30 days or less from discharge. And over 79% of those are preventable. So what we've found is that when home instead senior care services are implemented at the time of the hospital discharge, we've found that 96% of clients remain in their own home over 30 days and out of the hospital. 93%, sorry about that. 93% remain out of the hospital for over 60 days, and 90% remain out of the hospital for over 90 days.
That's what we all want.
That is what we all want. I think the big message is there's no place like home.
Amen.
And having the right help and the right resources can really make your life a lot better. So thank you for being here.
Thank
Thanks
you.
for telling us
Thank
all
you
about
very
it.
much.
Thank you.
Our pleasure. And to learn more, visit homeinstead.com/115. And for any other info, call 520-770-9943.